Hi, everybody. It's Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, on pigmentation. I am mostly going to keep tonight's, this is pretty much an open forum. We'll just talk a little bit about scars, how I did this patient, and then also I had a lot of questions that were backlogged over the previous nights, so I'll try to get to some of those ones as well. I had some patients that were asking me today and then during consultation and then also during the live yesterday about excision. So I wanted to show this result because this is a really nice excision result. This is with an elliptical excision in a couple of different spots, as well as punch excision. And you can see significant improvement over here. We're still working on this patient. He's still in the middle of this process, but it's really, really nice to be able to see that with elliptical excisions, we could really shrink the diameter of the scars. We could make it more superficial as well. So really nice for those patients who are asking, what does it mean when I talk about excisions and what are the different types of excisions? This is a really nice case. And also there's we have a full video up there as well, just from start to finish on YouTube. So you could watch that as well, which is really cool because you could see just step by step how we do each of these different treatments. In this particular case, I had to do Taylor Liberator subcision. I did excisions, elliptical excision, and then we also did ablative CO2 laser at the edges of the scar. So a few different things all under a single case. So it's nice actually for anybody that's interested in just all the different things that we could do. You could see that for this particular patient. And also, he's also a patient who's Fitzpatrick 4. So we have to be really careful with the skin. So a lot of different variables to make sure that we can get the best possible results. So really nice that we can get that. Do you recommend tretinoin cream after Accutane? Yeah, pretty much always. I would recommend some sort of retinoid after Accutane. It could be a Cleef. It could be, even just something generic or over the counter like adapalene. Just some sort of retinoid. Just try to use that. Ashley saying Bellafill is great. Tiger Aesthetics is awful. Do you order for Bellafill? Ashley, I haven't had any issue. Lisa's my rep. I don't know who your rep is, but she's been really, really great for me. And it's been pretty seamless. Hopefully you can get that sorted out. What's the best treatment for acne scars? It depends on what kind of scars. That's what we're showcasing over here. It really is about what kind of scars you have. And if we could see, your skin and I could evaluate it, I could kind of determine what the best option is from there. Hi, Ziamara. How's it going? Good seeing you on. We shared your video today, just a lot of really, really good feedback, a lot of positivity, as I've been saying. A lot of people really are very, very supportive of anybody with scars, and it's amazing. It's really, really cool. It's like I said, a really tight knit. It ends up being like a tight knit community. I think even interestingly enough, we have patients that come on over here, people that come on here who don't have acne scars, but they just wanted to kind of support other people that go through this process. And that's amazing too when you actually think about it. Just sometimes it's really interesting because you may notice when you're scrolling through TikTok or something like that. And it's sometimes I look at things I see sometimes there's people that are talking about the situation that's happening for them in Congo, things that are happening in Gaza, of course, the enormous atrocities that are occurring all over the world, and now over here in this country with the way they're treating refugees and migrants and trans. And it's you see those, and it's sometimes it's just nice to have other people just to pop in and just give some support, even if you're not part of that community. It's you just try to say, we're here and listening. We're going to try to help you in some way, some point, or just learn from those people. And it's really cool. What's the best for textured skin? So usually laser more for textured skin. It's usually that. I end up doing mostly lasers for that. Do I have an office in New York? No, I don't. I'm just over here in Newport Beach, California. I just really try to make sure that everything is just done at a very, very high level. And so just at our practice over here. Hi, Dr. Qazi. Do you do some of these treatments on yourself or do you get them done by someone else? Asking me because you're so great at it. Thank you. I did train somebody, and now she's currently in PA school, but she's usually the person who does it. You'll meet her at some point. Her name is Maddie, and she's amazing. And you'll meet her. And she's somebody that has a very, very great hand. And so when she's done with her PA school, she'll just come in, jump in seamlessly. I misread that. It's Recentil is, hi doctor, I'm Cynthia. Just wondering, what does the tape do after laser combo I had 2 weeks ago? Good question. Hi Cynthia, by the way. The tape is basically when I smooth down those thick edges of your scars. Remember, I was like basically going at it with this ablative CO2 laser. Like, look at this patient right over here, those thick edges. I made him do the silicone tape also. So basically, I'm trying to make sure that friction doesn't occur, and so that would actually cause it to get a little bit more hypertrophic again. So I want to make sure that I can keep it flat. So I use silicone tape there actually for quite a while. It works out really well. E is saying, I want to get scar removal, although I have a damaged skin barrier that reacts to everything. How do I treat my damaged skin barrier? Well, what happened? Why do you have a damaged skin barrier? Because it's possible that we just have to, just wait if you did a procedure, moisturize, just give some sunblock, and we may be able to do something right after that. But not sure exactly, what that means that you just have a damaged skin barrier. It shouldn't be like always permanently damaged. Ziamara is saying, I love it here. I truly feel blessed. Thank you so much. That's what, it's a very, very supportive community. I love that. I really do. Soul Matcha, how's it going? Hope you're recovering okay. I noticed that when you do TCA, you turn off all the lights and use a light bar. Other times you use the overhead light with room lights on. How do you decide? Well, it just depends on which room you're in. You met me, we were doing the room in one of the, we were doing the TCA cross in one room over there, and in the other room, it just would be too bright. And so that's really what it comes down to. So I just use there's no windows in one room. There's windows in another room. So it just sort of depends. But I have those big lights there because of that. So that just helps me so I can see it. I'm constantly angling as I'm going along. And it works out really, really well that way. It just like constantly can adjust with that overhead lighting there. So it just depends on what room we place you in, but either way, we could see those really well with the angle lighting. Ziomara is saying, I was watching your journey doc, and your skin looks amazing. Thank you so much. It's, again, it's a journey. It really is. It's definitely was not something overnight. Definitely was not something with just one treatment. It was like a long, long process to be able to get to something where I feel comfortable with. And it's really, really nice that I don't have to stress about things, as much. Like here and there, I look at it's like, it's not as great as it was yesterday or something like that. But like, it's like, that's how human skin is. It goes up, it ebbs and flows. Some days it may look really great, and it just depending on your rest, your oil production. And some days it may not look the best, or like there's somehow you have like some irritation on your skin. Like, I don't know how that happened. What did I do wrong? It just suddenly popped up. And it's like, it's tough because it's like you go through your head, it's like, it was perfect, and now that one lesion bothers you. And it's going to be an interesting process as you start getting like your skin healing and you start seeing that it's improving over time. You'll notice that actually like little lesions here and there do bother you, and you sort of have to remember that there was a point when you had a lot more than that. And just like remind yourself, like imagine looking at yourself at 16 years old, how happy you would be with this kind of skin with one lesion. So like, just kind of remind yourself of that. I know I would have been really happy. I wish I could tell my 16-year-old self that like one day it's going to be really cool, and one day it gets better. Do Hollywood peels help with acne scars? Not so much. No, it could help a little bit with some of the pigmentation, but not so much with the scars. It'll help a little bit with just like exfoliating a bit, not more than that though. Recentil is saying, I can already tell a difference, so I'm excited. Awesome. I'm really, really glad. So the one thing is that when you just do a treatment, it is going to look great for the first month or so, but it does ebb and flow. So just like don't kind of focus too much on just the fact that it looks great because it's a little bit swollen right now. It goes down a bit. As that swelling goes down, you may get a little bit disappointed. You start seeing the scars again, and then it starts slowly rebuilding because you get that collagen response over time. And you will feel like your scars are softer, though. It is going to feel like it's going to be softer. And are you familiar with HS? And can a patient with this condition get this? Yes, absolutely, we could do that. And I could treat the scars from HS directly, actually. Can you inject Bellafill into temples? Yeah, I do it at least once or twice a day, pretty much. I do so much Bellafill in temples. That's what I did for this patient too, actually. And we're still working on him and still putting some more Bellafill on this patient. It works incredibly, incredibly well for that area. Angel is saying, I just finished watching the Ziomara video you uploaded. It inspired me to accept myself and give myself some grace with my severe acne scarring. I'm really glad. I'm really glad that happened, actually. I was talking yesterday about how people with acne and then, of course, with scars, they really need to forgive themselves a lot more. There's a lot of guilt that's incorporated with this. Part of it is because people external pressure is such that even if they're loving and they're caring, they still may think that you're not doing the right treatments for your acne, and they sort of assume that you haven't washed your face properly or haven't been using the same kind of creams properly. And they had like a nephew that had bad acne and they took like this herbal supplement and it worked, and why don't you try that? And they're like shocked and upset that you don't try that right on time, and things like that. And just there's a lot of guilt with these things, and you're like, listen, I'm like under treatment, I respect this person, I'm going through this whole process, and it just takes a little bit of time and just a lot of external pressure. And then some people, because of the anxiety, because of the acne, they start picking at their skin. That's not the reason why everybody ends up getting scars, but it happens. And then years and years later, there's a lot of anxiety and depression about the fact that you may have caused your scars, and you feel guilty about that. And part of what this process is and this journey is going to be is really just to really accept the fact that you were a young kid, and maybe you made mistakes with your face. It's time to just forgive yourself really for that. It's like, who really is sitting here for every single moment and every single failure that you did when you were 12, 13 years old? I don't remember most of those things, but sometimes it's with acne and scars, you're reminded of that big error that you made when you were a little kid, and it's really terrible. It's really tough actually to go through that and feel that pressure. So forgive yourself, really. It's like one step. Just start doing start working on that and thinking about that. And Star Rod is saying, I never picked and still got scars. And actually the same with me. I didn't either, actually. It's just unfortunate, it's that I guess I shouldn't say ever. Some here and there was sometimes I felt like it was a little bit bigger, and I was like in like the shower, I would kind of do it, and it never actually caused a scar for that area. But also it was like, I look back and I was like upset sometimes I did those things, but I was like looking back and I was thinking to myself that I was also really upset and self-conscious of like that pimple or whatever else was bothering me. And maybe I felt like I had to do it at that time. It wasn't the right decision. I shouldn't have done it. But, I have to, again, forgive myself. I was like a little kid and I was like upset that I had like this pimple on my face and I wanted to solve it. So it happens, it's like, you just have to kind of just accept that you were just a little kid, made mistakes, and time to just work on it and improve it. Photofram is saying, I remember large acne was there in my face that itched. Yeah. A lot of people with acne will say that it really was painful, and it's kind of interesting that it was really, really painful actually. And eventually, the scars aren't like that same kind of pain, but like you look at it and like, you don't necessarily remember how painful the acne was, but you do remember maybe even each lesion that exploded sometimes on you. And it's a tough feeling too. Let's see here. Soul, where's Soul? I missed his question. Soul Matcha. Okay, Soul Matcha is saying, how often do patients have to get another round of ablative and or erbium laser after one session? Well, it depends on the kind of scars. I would say for your kind of scars, would probably wait about 3 to 6 months before doing it again, and probably like 1 or 2 more times potentially for your kind of scars. Let's see how I definitely smooth those things down really well. We'll see how that goes. Use your silicone tape afterwards while you're recovering. I think, again, like I talked about, though, a lot of things are also with the volume loss there. So we'll slowly put some volume in there. And as we do that, I think it's going to look a lot better too. So let's see. In your skin type, Asian skin type, I usually don't go with too much heat, too much energy, multiple times. So I try to really just go and really effectively, and maybe in the future, it's not going to be like as much with like ablative CO2 laser, things like that. Maybe just potentially just more like an erbium laser. Still is saying, so is smooth skin possible with more sessions? It depends on what your starting point is and how much volume loss there is and things like that. That's really the big factor there. Hello, doctor. Do you use Phenol for acne scars? Do you recommend it? Yeah, I mean, for some very severe scars, it's one of the best options for very, very severe scars in the right skin type. Fitzpatrick 1 through 4. It's definitely a better option for those kind of patients. MediGlow, how's it going? Do you feel that RF is much more superior to microneedling for acne scars? Do you use RF? And I do not believe it's superior. First of all, I don't agree much with using microneedling for most scars. This patient right here, he did microneedling. He did a bunch of clear and brilliant sessions, didn't improve his scars at all. I forgot how many sessions of clear and brilliant. I think like 8 to 10 or so for this patient before he saw me, and it didn't improve things. So I'm a big believer in doing manual work, going in there, actually breaking up scar tissue if we need to for like subcision, doing TCA cross at the right particular areas, the right spots, doing that, doing excisions if we need to do that, doing volume replacement. Those things are really, really beneficial. Yes, we do the laser. In this case, we did the laser as well, but it's not the biggest factor for all these for these things. Radiofrequency, the biggest problem is that you may end up melting fat with the amount of heat, the amount of energy that you have to use for acne, for scars. You won't believe how many patients have come to me and said, I've done, the XYZ laser or radiofrequency microneedling device, and afterwards I've noticed that there was a big indentation of fat loss. And I'm the kind of person that, like, if somebody tells me these things, I assume it's possible. I think it's like a lot of things are possible out there. I keep an open mind about these things. Some things it's like, low likelihood depending on like the heat and energy. But with radiofrequency microneedling going that deep with the amount of heat that a lot of people end up doing, it's very possible that they are melting fat that way. So I would not recommend doing it for acne scars unless you're doing it for like skin tightening. That's a different process. It's like, there's a laxity with the skin that occurred when you had acne. You were smiling around the scars and stretch out your skin. And now you have to actually do something to tighten the skin. That's very, very different than saying that radiofrequency microneedling or microneedling is going to help with the scars themselves. Very, very minimal effect, if at all. Photofram is saying 7 days for fractional fully ablative. It can go up to 2 weeks for recovery. Use sunscreen, SPF. Thank you for helping out the person who was asking that. So basically what he's saying is that for recovery wise, it could take 7 days or up to 2 weeks. Most patients in my practice, 4 to 7 days. Sometimes ablative CO2 laser, yes, it is still going to be right for a few weeks afterwards, but you can be, more, you can be more customer facing if you are that way. Also, sorry you choked on your water yesterday. I saw that. I was standing by right. That's funny. I didn't see that you were on here yesterday. Actually, that's funny. I did actually end up choking a little bit because I wasn't drinking enough water. That was something that was in my mind. Silicone, I know for all process different prices, but do you know what it is on average per process, like $3,000 to $5,000? Most patients for their scar treatments spend about $5,000 to $7,000 for their process. If they need more volume, it could go up more. This patient, he needed multiple steps. It did cost more for him, but most patients $5,000 to $7,000. It depends on how deep or thick the scars are. Also, by the way, I love seeing my patients on here. Thank you guys for coming on here. I love having you guys come on here too, because I don't get to talk to you. I know that I talk a little bit while we're doing the treatment, but I'm also really focused and concentrating on certain areas especially. And so I don't get to talk as much. So I really love you guys coming on here. And it's actually a lot more casual. And I actually would prefer, it's awesome to be able to just to talk. Sometimes I just want to sit there and talk to people. I'm a very curious person. I just like to talk to everybody actually. So it's I just like to just go on and on and on and listen to about the world that people are in and what their job is or what their interests are and what they want to do in the world. And it's really interesting and exciting to me. So it's I like the fact that you guys came on. I see so many patients today. Actually, interestingly enough, so many people came on. Hi, Joey. How's it going? And appreciate all of you guys that came on today. So thank you for that, because it's it's fun. I know I do the procedure and I can't really talk as much, and I kind of wish I could. But at some points I just have to be we have to concentrate. I have to be exactly really precise with that, and just really focused. So, and then other areas, it's okay, now I got the rhythm down. I could talk a bit, or in between a little spot there, but it's nice just to chat. Anna's saying, I have acne scars and just got my wisdom teeth removed on day 2. Oh man, I got my wisdom teeth removed before too. That's really you puffed up like a chipmunk for 4 days with that. Let's see here. Oh, yeah. So someone's reporting that thank you for the realistic photos. Most other dermatologists post Photoshop photos. I wouldn't necessarily say that people are doing Photoshopped photos, but what they do a lot of times is just, and it's super frequent, is that the photo is just one saturation, the other one's the next saturation. It's overly exposed, or it's just the totally different angle, things like that. And it's really, difficult to kind of evaluate if this stuff actually works, because anybody with scars knows that just a little slight deviation of that angle can make the scars look a lot less, with the depth of it. And I want to show you like what to actually expect. Like, I want you to actually have that in your mind, so you can understand that like there's like a certain journey with this, and it's pretty clear for you. I'm happy to help everybody and get you to like the best possible results, but I want you to know what the best possible results really are. And I think that, people that sort of showcase over and over and over, like patient selfies, or like just only showcase, and some of these selfies are filtered, it's true. And it's like questionable, that like they're doing this and they're trying to charge thousands, tens of thousands of dollars sometimes, and they can't show consistent type of photos. It's, it's concerning. Can we get like amazing, perfectly smooth skin in certain patients? Yes. But it is a longer journey than people expect. And I would love to showcase that for everybody. Doctor, what's your experience with dermabrasion for small superficial scars? Can it make it go completely, and chance of hyperpigmentation after the procedure? So interestingly enough, I like it for certain areas, like sometimes like nose scars right around over here, for example, like post rhinoplasty, for example. You could do a little bit of dermabrasion for that example, but you're more likely to actually get the risk of hypopigmentation for some patients if you go too deep. I've seen some people, they use motorized tools to do it. I don't do that. Actually, I think that you could run into a lot more risk when you use motorized tools, especially in with certain ethnicities. You could really then get that risk of hypopigmentation. But the way I do the laser, like this patient, for example, the CO2 laser, is very similar to a dermabrasion process. I'm sanding down, but I'm using a laser. I'm doing that. Marjo is saying, Dr. Qazi makes you feel comfortable while doing his procedure. My BP was elevated prior to the procedure, but he made me feel relaxed by talking to me and making conversation. Thank you, doctor. Appreciate you so much. Thank you so much for coming on and saying that. Thank you. And I was saying that earlier, that I don't know anybody else who checks blood pressure before these procedures. I've caught it many times, actually. And I'm not saying that people have like hypertension, but like there is such a thing as white coat syndrome. And you're doing an invasive procedure with me, and I appreciate it. I know that you trust me and all those things, but like at the same time, there's a lot of anxiety for a lot of people. And, I want to make sure that when we're doing these treatments, it doesn't go sky high. And I've caught it sometimes where it's super risky now to do these treatments. Before I even do it, I stop it because I was like, the blood pressure has been too high, it's still too high, or the heart rate's too high. That's happened too. I caught that too before. How can the after photo be improved more? Good question. Really, really good question. So actually, when he came in for this photo, we ended up doing some Bellafill for the patient. We did some TCA cross for the patient as well. Worked out incredibly well. And then at some point, we'll do another round of laser for him, more Bellafill for him. He has a lot of volume loss. He's actually a young gentleman, really young, but his scarring was really severe scars. He said that he wasn't somebody who did much with them. It just ended up happening where he just ended up getting severe scars. And he remembered, I was like, these are the lesions that we're going to have to cut out and do excisions with. And he's like, I remember that pimple. I remember what happened. And, it's like a lot of times I'll hear that story from a lot of patients. They'll tell me that, it's that they'll remember like this spot. I remember it. And it's interesting because like anybody who does these things and a lot of patients will tell me that like, I know that you worked on that particular scar a lot. And I remember that scar was like a scar that really bothered me a while ago. So it's nice that it's cathartic, I would say, eventually. Sangeeta is saying, sir, how can we reduce the redness due to TCA cross? Just moisturize. I remember you told me yesterday that you just did it like a week ago or so. Just a lot of moisturizing and sunblock. So I wouldn't worry too much about it beyond that. Just put a lot of like Vanity cream, for example, and then a lot of sunblock. That's probably all you really need to do. Photo frame is saying, after 25 years, collagen production gets weaker. So with age, do we need more powerful treatments? No, but you do have to just start replacing that collagen production, that volume loss as you get older. You're right. As you get 55, you're fighting basically now the natural collagen that is breaking down, as well as the fat loss that's breaking down. So we have to catch up with that. And that's why this process of volumization could be a little bit slower and more frustrating for people than they expect. I wish it was a lot less expensive expensive. I wish all those things, but unfortunately, it's not the case actually for the way we have to do collagen fillers. We just can't overdo it. It has to go slower. When I did it in my own face, I went very, very slow. And it was like, I wish I could have just rushed it and just like put a bunch of filler in there and just like walked away and called it a day. But I knew that like it just had to look a certain way, and I was looking for a certain aesthetic. So I had to go very, very slow with it. Are the results 100% permanent? The texture is something that you got to keep, but the volume loss could potentially occur again as you lose fat, so you do have to keep up with that volume loss. But texture is there. My texture stayed really excellent, actually. There's things that you want to do to control oil production in the future, like topical retinoids, things like that. But it's awesome. It's really nice to feel like just your skin's soft, actually. It's really fun. Really cool, actually. And like I said, it is like, it's cathartic. It is. A lot of times what I do on these things, I just feel good. Like I look at it, like I did that. And it's like, I look at this patient and it's like, it's awesome for me that I could get to improve someone's skin that he had suffered from for so long. And I just like, I like helping people, and I like I like a world where there's less suffering. So it's like, to me, it's like, that's really good. And, like this year I'm going to be doing a lot more like burns and things like that. And so it's like, I love like doing those things. I love treating that stuff because it's like these things, scars, burns, pigmentation, volume loss, even all that really does affect people's self-esteem in such an enormous way. And it's very isolating and lonely because it's tough for people to admit to their friends. It's tough for people to other people to understand what you're going through. Even family members don't really understand what you're going through. They may have seen the scars, but it's difficult for them to really quite comprehend how serious this effect is on people's mental health. Like I said before, this is like a small community. It's like a small, tight-knit world that everybody sort of understands. It's like, you start to realize that there's like a circle. There's a group of people that have experienced the same trauma. And even if their scars, that's why I don't like when people say, well, your scars are so superficial, what are you worried about? They still may have suffered from it. Even if the superficial scars, maybe they view themselves at a certain way, and it's tough to to look at themselves that way. And you don't know that maybe the person is like on camera all the time or dreams of being on camera a lot. And it's tough to see actually when they're looking at themselves, and it's like difficult. Or I have patients that are in the entertainment industry and things, and it's like tough for them because it's like they wear makeup, and the makeup actually makes the scars look worse. So it's best, honestly, like just like in this world, just to like not judge people for what they have or anything really. Like just like accept that. You have your scars, they have their scars, and don't don't punch down. Basically, don't try to actually also make people that look worse than you, make them feel worse than you. Don't make yourself feel better because this person, they're otherwise a good-looking person, but they have scars, and I'm going to just try and knock them down a peg, things like that. Like just be more supportive in the world. And at least we have that in this right now. At least we have that skin community where people are very, 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 very supportive. You look at all these messages, look at all these comments here. It's amazing. And we can get that. Starrod is saying it affects our mental health, and it doesn't help that these treatments aren't covered by insurance. You should push for it. Just fight for it. Fight for it constantly. There's a lot to fight for. I don't know what's going to get pushed out. I don't think they're going to do much at all anymore, but just push for it, just keep on knocking on the doors to just keep bothering it. We are a pretty big community still. Like a lot of people suffer from acne and from scars. A lot of people like really do understand this, that if you don't have money, you could really suffer as much as for a very, very long time. So it's really tough. Gabe is saying, Gabe, how's it going, by the way? Gabe is saying insurance will never approve. Right. Yeah. They're canceling policies for people that had, fire protection. They canceled it just like a couple of weeks before the fire. So of course they're not going to do it. And try to change the whole thing. Try to change everything. Really, like just, this should really radicalize you. Like acne, scars, pigmentation, all these things. anything within the health industry, it really should radicalize you, like just navigating your health. It really should be something that like is very, very eye-opening. And if it was tough for you, you should think like, man, it must be exceptionally tough for people that don't have money. And it's enormously tough, which is why, this year we are going to be doing a bunch more pro bono work. It's already full. I appreciate everybody that still applied for it, but I really do want to solve this for a lot of people. And I want to showcase to everybody, I said before, this is basically like open source. Like I'm keeping this open so that people could see how to do this at a certain level, how to like achieve a certain result over and over and over again. And it's on purpose that way, because I actually do believe in more of an open source type of world. I believe that things should be more cooperative instead of this competition. I mean, don't compete with someone like me, because it doesn't work that well. But instead, try to cooperate, and we will work together and try to get the best possible results. Like younger people that are trying to go into this industry, things like that, they're looking at this and they could see that maybe they could push it a certain way. They could go about with new technology, something else. Awesome. Let's learn. Let's figure out how to get this better and better. And let's do it. That's the only way that we can advance science and medicine is really by doing it open source. Everything right now is so closed. You try to open up any journal article. If someone says, oh, there's an article about this, well, it's under a paywall, and it's like, how do you get to that? It's like $600 sometimes for these articles to access them. Seriously, it's ludicrous, like to access all this stuff. And it really should just be that medicine and science is just open. And you should just be able to have access to it and just be able to see and learn. And then someone else could look at this and think, even if you're not in the medical world, you could look at this and think to yourself that maybe like I'm an engineer or something like that. Maybe there's a way I can improve this. And tell me, I'll be awesome. I'll be open to it. Let's see what ways we could do, what other treatments and ideas are out there. I'm open to everything. Like it doesn't matter to me. If we could get something better and better and better, I could do it. As long as it's safe and we could work on it and figure it out. Like, let's do it. Let's try to advance things. And Gabe is asking, is this one session? This at this point was one session for this patient, correct? At this point. Do you think LED treatment is worth it? For certain things, if a collagen stimulation is good, it's good for healing, recovery. The problem is that for some patients who are darker skin type, like for example, red light therapy, there may be a chance that you could get more melanocyte stimulation, you can get more hyperpigmentation. So that's the thing I'd be worried about there. Photofram is saying, just because of risk, Phenol is not done. Phenol can cure scars completely as shown on Instagram. Is it true? No, it's not true. It's not true that it'll cure it completely. It can improve it quite a bit. But if you notice a lot of the photos that you see on Instagram, we have some results on our page. You could take a look for some of the Phenol results. But there's still some scarring that's there. There's still some scarring that's visible. And it's like possible that, it needs multiple different things otherwise. You may need fat transfer, you may need subcision. And a lot of those results don't show those additional type of things. And so it's questionable. I think it's, a lot of times I've also found that people have, discovered that they've gone to these type of things for Phenol, and it was done in practices where there wasn't like an anesthesiologist present, and there wasn't, a heart monitoring present, things like that. And it was really, really risky for patients. So there's a lot involved with this stuff, but Phenol, it's great for the right particular patient. Fitzpatrick 1 through 4, deep, thick scars, great for that, but it's not like it's going to give you like this perfect result by itself. You still have to do volume replacement. You still probably have to do subcision, still have to do other things to be able to get that amazing result. But yes, you could get an amazing result with it combined with other things. Reese's Buttercups, awesome. That used to be my favorite thing, actually. I have carried my acne scars for over 2 decades, and it has truly hurt my self-esteem. I still cannot make long eye contact because I don't want people to stare at my face. That's really tough. Honestly, that's a really tough, actually, process, because it's the reason why I'm saying it's tough is because it's easy for someone just to say that, like, don't worry about it, don't pay attention when someone's eyes are drifting to your scars. But it's a natural concern that you may have that somebody is judging you for your scars, and you may feel that now they're sort of putting you a little bit lower than how you may view yourself. And it is tough, actually. But you may want to try to flip the script a little bit and sort of assume that maybe people's intentions aren't quite what you're thinking. It's possible that they were just a little bit curious about what that was, and then they realize, okay, and then they go back to your eyes or so. Or they may have been thinking to themselves that maybe this person suffered even. It's possible that the person in front of you is actually a good person and was just thinking to themselves, I suffer from whatever condition in my life at one point, and this person also suffered. Should I mention anything? Should I say something? No, maybe I won't say anything. I don't really know this person. I'll just go continue on the conversation. It's possible, maybe they did some treatments and like they feel good about their skin, but they kind of were thinking to themselves, should I mention something that I mentioned? I went to somebody, should I do something? And you don't necessarily know all that, but because you may have some low self-esteem and you're self-conscious about it, you sort of think the worst of somebody. But it's also possible, if you look at all the comments on here and just day-to-day world, if you realize actually that the vast majority of people actually are more supportive than you expect, actually. It turns out, really, if you look at Ziomara's TikTok video as well, it turns out that a lot of people are actually a lot more supportive than you may expect. There's a few trolls that are out there, and there's a few bots that are out there, all that type of stuff that like try to push like this negativity in the world. But it's really by like a few people that are just there's some people that just love to see people suffer. There's some people that they love it just because it just makes them feel good about themselves. There's other people that love it because they just want to cut people down so that they could feel a little bit more elevated than other people. And they don't realize that, we're really within the same class. It's like we're closer to the people that get bombed in refugee camps than we are to people that $300 billion, And it's like, even if you are going to be in that multi-billionaire class, it's like you still are somebody who's within a system that has trapped you into like this whole, and you really should be focused more on improving the world and improving things for the next generation. So it's like, and it turns out there's a lot better people than you have expected. That's all I'm saying. So when you're looking at someone and they seem to be looking at your scars, just sort of remember that maybe it's not like necessarily negative. Maybe they actually do have like some positive vibes for you, or they're thinking maybe I could help you out with something, possibly. And if you think maybe in terms of that, it could actually relieve some of that anxiety and that stress that you have there. Verteporfin update. I'm working on IRB approval for something I'm trying to work on for the body. So if I could get the body approved, then eventually I'll try to get to the face. So that's what I'm doing. I have the FDA waiver to do it. I'm trying to actually just get it really defined so I could do a little bit more like closer to the neck area for some things that I could potentially do for like facelift scars, things like that, that are behind the ear, because that's technically body, not face. We'll see if we could get that kind of approval too, because that could hopefully get us closer and closer to the face and allow me to do things more for the scars. So that'll be nice if I could get that approval. So waiting for that type of thing, but it's gonna be a little bit of time before I could do the face. Eventually, this should hopefully be a little bit faster, and then once I could get that, essentially for the study itself, we're gonna have to do individual patients and with each vial of Verteporfin, and I have to circle back with a group to basically see how we could get that crowdsourced as well, to get more people for more volunteers for that once it's ready for it. So I'm not quite ready to bring that up for everybody, but eventually I'll get it so that we could really go and see other kinds of scars on the body. If you have surgical scars, I'm interested. If there's things that we could excise without much tension, I'm interested in that. The reason why I would like to do facelift neck lift scars is because there's less tension over there. It'll be really good. So if I could get approval for that, it's not exactly a face, then that'd be great. So for those who don't know, Verteporfin, basically, it's a drug that if you excise the scar, you could hopefully get it as close to scarless as possible. Afterwards, you put the medication in there, and hopefully you could be able to get to it as scarless as possible. I did get an FDA waiver to be allowing me to do it on the body. I am trying to just see if I could also get it just for the neck area, just over here for facelift and neck lift scars. If we could get that, then awesome, and we could be able to go and move forward with potentially doing like facelift neck scars as well, and then eventually, hopefully, then more with acne scars after excision. Let's see here. Gabe is saying, how many Bellafill did I do on my temples? I did about 6 total, actually, for my temples. It took a while, actually. So 6 total, actually, for me, in which I had a lot of volume loss. So that's partly it. But it took me a while to get there. D is saying, I have a treatment appointment with you next month. Do I stop using tretinoin? And I'm not sure what treatment are you talking about, though. It depends on what we're doing. Have you seen Verteporfin on the face for acne scars? No, I have not. Unless somebody has it. If somebody wants to message me, if they have something from there, that'll be helpful, actually. If somebody has it for acne scars on the face, I could eventually, hopefully, start arguing that we could do it safely on the face as well. But I have not seen anything for Verteporfin on the face.
Heidi's saying, I got 6 sessions of laser genesis and my PIE barely faded. What dramatic laser would you recommend? Oh, XLV works well and V-beam works very, very well. I wouldn't really do much with laser genesis for PIE. It's not going to help too much for that, to be honest with you. Unfortunately, I wish I wasn't really pushed that way, to be honest with you. What do I think about IPL? It's one of the riskiest devices out there. If it's done well, it's done awesome, but it is one of the riskiest devices, actually. So it may end up burning the skin, especially in darker skin types. Do you ever cut and stitch a scar area? Yeah, this was what we did with this patient for the elliptical excisions. And then also for wider punch excisions, I do that. So yes, depends on how wide it is and you know, how much tension there's gonna be afterwards. That's kind of what the things I'm looking at there. Vinny Shelby saying, I'll see you on Monday for my nose scar. I'm really hoping you could help. If I said I could help it, I really do strongly believe I could help it. So I look forward to seeing you on Monday there, Vinny. I appreciate everybody tonight. I'll be back on tomorrow night. Let me know if there's other pressing questions. I'll just keep it like kind of more of like an open forum tomorrow. Just like ask me anything type of thing. And hopefully I'll be able to answer all those questions. Oh, by the way, I saw a bunch of people I'll say hello to just really quickly. Hi, I am up. How are you doing as well? What treatment did this patient do? This patient did elliptical excision, Bellafill, Taylor Liberator subcision, ablative CO2 laser, erbium laser as well. So we did a few different things actually for this patient. His full YouTube video is on as well. You can watch this whole thing step by step actually for this particular patient. You can see it from like start to finish.